rolling down, rolling up. You don't want to do that. Coming up like that with crescent pose. We don't want to do that. Could people do that? I have people in my cancer class who have pretty profound osteoporosis from the cancer drugs. Can they do this? Yes. Did they start doing this? No. Have they been practicing for 9 years? Yes. So again, it goes to time, right? But certainly we're talking about when you first find out about somebody and they're brand new to yoga, you're not going to do anything like that. Cantilevering over the hip hinge with spine unsupported. Could they do that down the road? Maybe. I have students who have osteoporosis who do Vinyasa just fine, and they have profound osteoporosis, but they're very strong because they've been working on their legs in Warrior II and on their hips for a long time. So you're certainly not going to start there.
Cat stretch,
Cat stretch again. You know, you don't want them to force, but a little bit of cat stretch, sure. Excessive or leverage twisting of the vertebra. So a lot of cranking in any pose, no good. So revolved hind lunge, you know, only if you know them, only if they're strong and they've been there for a while. Forward flexion of the thoracic spine. So anything where they're doing this, you know, if they have osteoporosis of the spine, one of the most common areas to have osteoporosis is in the front of the throat. So these bodies can get, this is something, you know, not everybody has osteoporosis all the way evenly through their bodies. So like it could be worse here. So doing this, head down, not so good, yeah? Can they gently, with their shoulders back and down, move their chin a little bit, move their head a little bit to tolerance? Yeah. Are they going to stay there, push your head down, reach down, stretch? No, right? Can they move a little bit? Yes. Can they turn their head a little bit? Yes. It's just how much you're doing it. So you want to emphasize light on that kind of thing. No pulling. I wouldn't do any sitting up and pulling on the head with somebody with osteoporosis in their neck. Again, I mean, as I say that, I'm thinking of somebody that does and does that just fine. But again, she's been practicing for 9 years, so, and she's in her 70s. So too bad we didn't get her before she got that old. But that's a cancer drug, so. All right. Back bending with leverage forwards, crescent pose coming from the floor, bridge with hands clasped under back. Can they do rolling bridge? Sure. Just depends. Are they going to start there? No. It says, do assume that older women 70 plus, this is for ultra gentle Alice, may have some bone loss and pay attention to the don'ts, right? We're not going to put any force on their backs. If they tell you I have osteopenia, I have osteoporosis, what does your doctor say is safe? Have you had an exercise program, a physical therapist? What do they say? Everything hinges at the hips, neutral spine. What if they have hip osteoporosis? You know, we have Gail Ament who comes. You know Gail? Gail. She has hip osteoporosis, just on the edge of hip osteoporosis. She's really osteopenia. But her bones, since she's been doing lots of one-leg standing poses, T-pose, all that stuff, her bone density has gone up in her hips. So we certainly don't want to keep her from doing that, but I just think the big thing is unsupported. Put the hand on the block, get some extra support. So they get the weight in there, but they're not hanging in the joint, yeah? All standing poses, all safe one-leg poses are really good for bone building. Alice balance practices, that's why Christy does so much balance. So if you have bone loss, and you do fall, better that you have done some balance exercises so you don't fall, right? Doesn't mean you're not gonna, but even like things like this helps to build the bones in the wrist because it's stress on the bones, right? So even for our older folks, so that when they fall, I just had somebody not two weeks ago at the cancer center. She said, I fell right on my wrist is sore, but I'm good to go. She didn't break her wrist, So, but we do a lot of wrist stretching. I'm not saying that's why, but all of those kinds of things, because anytime a muscle contracts on the bone, it helps it lay down calcium because the bone is withstanding force. So even if we're just doing stretching, but it puts some force on the bones gently, as opposed to just doing like this, it's gonna be good.
Audrey, what kind of exercises would help build bone in the spine though? I could never figure that out.
Sure, all yoga.
Just overall.
So if I'm leaning this way and I'm doing this, these muscles are contracting to hold me, right? If I'm going this way, if I'm doing this, everything we do in yoga, because your muscles have to hold your bones in midair. Does that make sense? So it's all good. Balance practice is super important. Wall push-ups, good, yeah. Plank, all of those kinds of things, you know, even if you, again, not in a beginner who's walking in, but it's good for people to do plank. It's good for people to do dolphin plank. It's good for our old folks to do a little bit of wall push-ups this way, or dolphin on the wall. Yeah, all those things, because it does build a little bit of bones, a little bit of weight bearing. Down dog is good if there's no thoracic humping. Rolling bridge and bridge can be too much. If somebody says I have spinal osteoporosis, I wouldn't do rolling bridge and bridge, right? Because that's a little bit up and down on those bones. Probably leave that out. But pelvic tilt could be okay, right? Just pelvic tilt, lift the hips up a little bit, but you're not going all the way down, and not right away. Crescent pose is okay if it's not too bendy at the lower back. You know, especially if you're just using a chair, or if you just go like this. Lean forward, put the toe down, sweep the arms forward, come up, just like that. Probably gonna be okay, yeah, because you're not putting that much force on the back. Again, that wouldn't be your first day's practice. Okay, so that's osteopenia and osteoporosis. Don't load the spine. Support the spine is the main thing. Dowager's hump, also known as kyphosis of the upper back. That's when you get this big bump right here. And sometimes that does come from osteoporosis. Sometimes those bones in the front have degraded and they're not supporting the spine up as well. But I mean, I liked that video that I posted today. I've always kind of maintained that a lot of, I mean, you can have any kind of, you could have like George, you know, with the eye issue where you start looking down. But I do believe that a lot of the Dowager's hump kyphosis comes from poor posture. Comes from working at a desk for years and years and years and being like this, and maybe your parents maybe have a little bit of a predisposition to it, right? So if you were like if you look at our Facebook page, I saw this thing and I posted it. She was talking about how the suck and tuck position, this tucking it, pull your gut in and tuck it under, which we've been taught to do. Look at my back, right? And you see people like this all the time, right? So I just love it. I just kind of turned it. I don't know where I saw it, and then I heard her say suck and tuck, and I'm like, ugh. And then she said, so we shouldn't do that. Stick your bottom out. I'm like, yay, cool. So we want to get people to stop doing this for sure. And this is really important, Alice, with your old folks, if they're already posturated like this, if this is their posture, don't have them do a million things with their arms up. Have them do one arm up, okay. But if they're doing this a million times, or standing, arms up, reach up, it's not going to help them at all. And if they come in and they have back pain, and now you've got their arms up, both arms up and both arms up, keep the arms down, because look at, you're loading the back, right? So one arm up is fine. That's why this is so great, because it unloads the back, right? Still moves the arms and shoulders. You can go this way. You can do the scoop without scooping. You can just go like this, right? So you're still taking the arm bone internally, and you're still getting lots of good stuff going on, but you're not having to do the big scoopasana. Does that make sense? Yeah. So I saw that one day in a class where everything, arms up and their arms up and their arms up, and they're all standing like this, and I'm just like, oh God, get those arms down. So just not two arms up, you know.
So Audrey, someone like Arthella, who stands like that with with her pelvis.
Right,
That's her posture.
right. So like a little bit of arms up once in a while, but not much, because it's really not doing anything for her, you know. I would say for sure, one arm, you know, all that kind of stuff, working on, you know, the chest, all of that kind of stuff, and getting that, you know, stretching her hamstrings. And then, of course, in the forwards, I know that, like, it's kind of hard because we've talked about this before, that how much can you harp on people about this? Right? This is not good. There's no doubt. It's not good. And so, like the first day they come in, they're doing that, and you kind of just make sure you get the hips, not level. Let's get rid of the idea that everybody has to have level hips. That's sort of down the road. I mean, if there's somebody who's 22 and they're standing and they're like this, then maybe you're going to pull their hips around. But just leave that instruction. Level your hips out. Because that's sort of a little bit later, and it doesn't really mean anything. Just say, because if I say level my hips, if I can't feel this, and you say level your hips, it's not going to mean anything to me, right? So then you say, draw the left hip crease back, and maybe that feels different, or you walk around and you help them. So then the question is, like, how much do we insist that people come up? So I like to kind of just do an overall kind of warning on that every once in a while in a class. So I'll say, you know, I know that, you know, it gets tiring to hear me say this, but let me just talk to you about what happens to older folks when they're like this. We don't want that to happen to us. So do we want, over the course of time, how many days a week do we do yoga to be doing this? What does that look like on your upper back? Is that where you really want to be? You know? And you make it a general thing. And then, you know, there are people like Linda Searle, who comes sometimes to Yoga 4 and has really kyphotic upper back and massively problematic hips. She should not be in that class. She would do so much better in Yoga 1. She'd get so much better stuff for herself. What are you going to do? She pays her money. She's not getting hurt. She's probably hurting herself over time because she's not doing what she should be doing for herself, and she's emphasizing the things that are already moving in a not so good direction. Like now, how long has she been coming to yoga? Since before you. And now I notice when she walks in like this.
Yeah, yeah, yeah.
And I'm only saying this between us. I don't use names outside of here, right?
So you're saying in that position, like, where you hamstring stretch or whatever.
Right, any kind of forward position.
That what we really want them to focus upon is not, though this is important, it's the back. We want the back as neutral as possible is what you're trying to
For both.
make sure they understand.
Right, right.
So showing them that is what gets them to see the difference.
Right. Maybe Pat, will you come and do this on the blocks, and I'll show you an explanation that I like.
But most people can't feel that they're like that.
Right.
Yeah, I know.
Right.
They don't.
And you're deciding, like, how much do I want to bug them about this, you know? So do the hips okay correctly, and then round your upper back, right? So if somebody is, like, step your left foot back more, and hump your back and put your head toward your shin. That would be quite common,
Yeah.
right? So,
I'm not stretching anything this way either.
right, and often it's even more than that. I'm going to test you. It's more up here, like this 13 inches is 6 inches now, right? So if I'm in a hurry, I might just come, I might not take the time to do a whole lot. I might just say, let's draw the chest for it. Watch the Dawn and I did this one the other day, right? That's that one. So, and then I just fix her head, right? Do it again, round. So I put my hands here. Is it okay if I touch your shoulders? Yes. Okay. There.
So it's really there isn't anything to do with the feet here because their feet could be in a correct position, but they're just
They're just humping,
okay.
right? So if that's it. Now if I go like that, go ahead, round, and she can't go. It's not easy. Why? It's because of her hamstrings, right?
Okay.
Because now her hamstrings are pulling her. You see, it's not because of her hamstrings because you can see her sit bones going up.
Yeah.
But often, can you tuck your pelvis a bit? Often it will be because the sit bone is pulling the pelvis this way, so the back is following, rather than the sit bone going back and the chest being able to come forward. Do you want to change legs? There you go. Hump the other way. So in that case, if it's that, what needs to happen? She needs to come up higher on her props, right? So cylinders, fists, whatever will get her in this direction. And she does this really nicely. So like, she would be really good. Stay right there for a sec. If you want to give a lesson on this, you say what we feel here is that from the anchor of the ball of the foot, energy is pulling back through the sit bone and up to the back corner, the back corner of the root. Now, if she's go a little bit lower and round your back and hump a bit, if her hamstrings aren't so flexible, that energy is not coming up and back, it's coming from here down into her foot. So it's shortening her hamstrings, right? Now come on back up if you would. Thank you. So in general, the way this energy should go is it should go from the foot up the back of the leg, through the front of the torso, pulling the torso forward, and down the back. Does that make sense? So this slides forward, this slides down, and this draws back. You could say it goes like that just to make it easy, but then that's very confusing, so I don't do that. I go foot to hip, sit bone, front of body, back of body, right? Does that make sense, everybody? And all of that's drawing down. And so now say she's a pretty flexible girl and she's humping. Go ahead and hump. And I have time, and let your head really hang, because there's a lot of people that will do this. Or no, can you put your hands a little lower? Like on the floor maybe? And they're really humpy like that, but they don't hurt yourself, but they're pretty flexible. So rather than grab her, which I could do, I could go like that and like that and get her down there, but I don't want to, because now she already feels a little invaded. Thank you. So what I'll come over and I'll go, let me give you a visual on this. So, and I've done this before. So what we're trying to get to here is not putting our head on our knees, but putting our belly button on our knees, right? So if you think of that front leg being like that, watch me and do it with me. Let's round our back. Now pull your chest forward toward me. Pull your ribs forward, lift your chest up, and now you're like a jackknife over that leg. You're not rounding that leg, right? So the ribs pull forward. And then maybe I'll go, so you want to feel lots of space through here. Yeah, yeah. So does that make sense, everybody? Okay, where did that come from? What were we talking about? Thank you so much, Pat. That was a good
Dowagers.
one.
We were on the chakras. Dowagers.
Dowagers hump.
Yeah.
Dowagers hump, right? Oh, yeah, okay.
And the video.
So we just, again, it's tough because people do it a lot, and you just can't beat on them. It's how much do I want to beat on this today? But it's a good thing to keep revisiting, for sure. All right, let's see. I just want to get through this sheet, then we're going to take a break. Oh, what I don't have on here, and I have to put on here, is spinal stenosis. So spinal stenosis is the sheet that says, what is spinal stenosis? So what is spinal stenosis? Anybody know?
It's a narrowing of the spine.
Yep, the spinal canal. Yeah, absolutely. So, and one of the ways that I like what they say in here that people can kind of tell if they have spinal stenosis, or the doctor will suspect they have spinal stenosis, is that it hurts, their back hurts when they sit down, but walking, especially forward walking, relieves the exercise walking. I feel better when I go for a walk. Then, when you're sitting, all the weight sits in the spine. If you're walking, unless you lean back when you walk, if you're walking and going for a good walk, your weight goes forward into your core and comes off your spine. Yeah. So that's kind of a good thing. And if we get, it's most often in the lumbar spine, but it's can be had in the thoracic spine and the thoracolumbar juncture. And there's, lots of different reasons that it could be there. My personal theory is that people who have terrible posture and are butt tuckers, guys with tight, I've seen so many men who have tight, butts, tight hamstrings, are usually thin guys, and they're butt tuckers, and they end up with spinal stenosis. Now, you can certainly have it as a woman, but I've just seen it so many times that I have this theory that you're constantly compressing that area because all the muscles are tightening over it. Don't quote me because I don't have any studies to prove that. But what can we do to help spinal stenosis? Lengthen. What else? Broaden, yeah.
Because it's narrowing, so if you do things that stretch the sides of your back, even like when we're in child's pose with our legs open and
Okay.
we're stretching from one side to the other.
Mhm.
And then the things when we do Chakravarkasana, because when we're coming back, you're always saying, separate your
Right.
your rhomboids.
Right.
So anything that pulls away from the spine, it seems to me,
That's a
helps
great point.
relieve the pressure and open up the spine.
Yep, that's a great point. I would take that. However, child's pose, if you have spinal stenosis, can be kind of painful because it puts weight back right into that lumbar area. Kind of depends. Sometimes it feels good, sometimes it doesn't. Basically, overall stretching is good. And there's nothing, once you have spinal stenosis, I think it's either gonna it's gonna progress or it's gonna stay the same. And your job is to try to hopefully just stay the same by doing regular yoga. Tom Brescotter, who comes to our morning classes, remember he struggled and came from horrible back pain because he really aggravated it doing Bikram yoga, got to the place where the back pain was still present enough that he decided to have the surgery, and it really changed his life. I mean, it was really a good thing. I would never tell people whether to have surgery or not, but I do believe that Baba Proda had stenosis surgery. A lot of our students have had stenosis surgery. I think it's a pretty good surgery.
So what are they doing when they do the surgery?
They just they ream out the bone. They ream out any matter that's in there so they make more space for the spinal canal. I wouldn't ever tell anybody to do that, but if, of all the different surgeries there could be, that one seems to be one that people seem to come back and be pretty good with afterwards.
So they open up the whole area in the back where the stenosis is, and they clean out all those bones.
So they'll MRI it and they'll look to see. They're not going to do a big. Sometimes they do. I think they did a lot more than they thought they were going to do once they got in there. But they try to be pretty. I think surgeons try to be pretty conservative. They don't do more than they need to. We hope. Let's see. One thing you could say is if you have people who have spinal stenosis, make sure you alternate sitting and standing, right? Because if sitting exacerbates it and you're doing too much sitting all at once, too much standing all at once, and particularly for your people who are kind of butt tuckers and they kind of load their backs, maybe you alternate more standing and sitting, right? Cervical spinal stenosis causes pain in the neck and shoulders, headaches, numbness, weakness. So that if somebody says I have chronic neck pain, I have chronic headaches, you're not going to say, oh, you might have cervical stenosis. You're going to say, have you had any diagnostics on that? And if they have weakness in the arms or excessive tingling that doesn't go away, like if I go like this for 10 breaths, I'm going to feel some tingling in my fingers for sure. But if they have tingling that continues once the hand goes down or once they leave, you just want to make sure that, they don't do that again. They make sure the hand isn't so far forward or whatever it is. And a big thing with any kind of cervical radiculopathy, which just means that you have radiating pain that comes from the neck, is not to have the shoulders tight, right? Not to work in neck stretches with the shoulders forward, not to elevate this and do this. So all the things we do that open this, that make space here, that when the arms come up, the shoulders aren't holding the weight of the arms, all of that will help any kind of radiating cervical pain, right? And I gave you that article on cervical radiculopathy just because I think it's interesting. It tells you what, like if it's C6, 7, where is the pain going to be felt? If it's, because it's different nerves that go down to different body parts, right? So, so I thought that was kind of interesting. So you don't really have to worry too much about spinal stenosis if someone says they have an area. Okay, if they have thoracic spinal stenosis, what are you going to make sure they don't do too much of? They can twist, but they can't crank. And for me, that's the big thing. Is you can do any of that stuff, you just can't crank it. All right, should we take a little break? And then we'll come back to, I think we're getting a lot done, actually. But we'll come back to piriformis, sciatica, and all of those fun problems. Sacroiliac joint dysfunction. Oh, yeah. Piriformis syndrome and sciatica. Yeah, Karen.
I have piriformis syndrome, so I think I know.
Yeah, good.
Piriformis syndrome is when your piriformis is chronically tight. And I think that what happens is sometimes when it's tight, it might push on the nerve that causes sciatica pain, but it's not generating from the sciatica, it's generating from the piriformis.
Yes,
Is that right?
that's good. That's exactly right. So piriformis syndrome comes from the piriformis muscle. Sciatica comes from a lumbar spine issue, which can have many reasons that you would have that lumbar spine issue. You could have pressure on the sciatic nerve, but often people will say, oh, my sciatic is killing me, but we don't know. You know, I got a bad sciatic, right? Oh, my sciatic is acting up again. So they don't really know. They just know that they have pain in their buttock, maybe pain down the leg, maybe pain all the way to the foot. Do you have pain to your foot, Karen?
Yes.
Okay.
Well, what happens is I'll get like a cramp in my toes, or like if I go to stretch them out, it will cramp like this right now, like it's stuck.
Okay. Okay.
So then I have to physically with my hand
Pull it back a little bit.
pull it back and unstick it because it'll cramp right through there.
So the innervation isn't getting down there if the piriformis is tight. Okay. And it can happen that when you have piriformis syndrome that you don't get referential pain all the way down to the foot. Sometimes people just have pain in the hip itself. Sometimes they get pain all the way down to the foot. It's more likely when they have sciatica coming from a lumbar issue that they get pain toward the foot. And the other cause of sciatic pain can be SI joint dysfunction, which usually just means that the SI joint is slightly out of place. So we'll look at all three of those. And again, you know, if somebody comes in and they say, I have my sciatic's hurting, you say, have you seen somebody? Have you had a diagnosis? Have you been told that you have piriformis syndrome, and you have an issue with your piriformis? Sometimes people will say, yeah, that's what I have, and that's good. Because if some medical professional told them it's piriformis syndrome, it's less scary than if they have sciatica coming from their lumbar spine. Maybe there's a bone spur, maybe they have spondylolisthesis, maybe they have a bulging disc, maybe they have spinal stenosis. All of those can cause sciatic pain down the back, right? So if they say they have piriformis syndrome, you're in good way. If they say they have SI joint dysfunction, you want to ask them, what are you doing about that? Because there are exercises that can be done, and sometimes I do them in private lessons if I really feel like I can do something, but more often than not, I'll say, what did your PT tell you to do, and what is your chiropractor doing for you to keep your SI joint in line, right? And then we keep it in line through our practices, but me helping them to adjust their SI joint, it's not my favorite thing. So let's look at page, in your book, let's look at page 152, if you would. I'm sorry, I apologize, 154. So those are the deep lateral hip rotators, otherwise known as the what? Abductors, right? The way you can remember is, what do the abductors do? They take the leg away from the body, right? An adductor, you add it back onto the body. right? It's kind of a nice way to remember. The adductors are here. They pull the legs into the body. The abductors take the legs away from the body, right? So AB and AD. You can see on page 154, the big sciatic nerve, big as your thumb, biggest nerve in the body. It doesn't just start where it looks like it comes all the way from the, you can't really see where it starts in this picture because obviously it comes from the spinal canal, it's inside the pelvis. But you can see how the piriformis lies right over it, yes? Can you see that? You see the muscle that's right over it? And what's really crazy is sometimes the piriformis is actually kind of split and has grown around the sciatic nerve. So that's kind of tough too. And unless, if you stretch your piriformis, if you have a healthy piriformis, it should be pretty much okay. So what do we not want to do if somebody walks in and they say they're having sciatic pain, regardless of where it's coming from? External rotation. We don't want to do laterals. That day, just leave them out. There's lots of other stuff to do. If the person comes regularly to a class and they have an ongoing problem with sciatica, you can have them do it small once they understand how to do it, where they're not taking a big thing, they're not forcing the knee out, kind of marking it a little bit. Or you can have them do, what I usually do with people who I know have a big problem with it, is I have them do, on the affected side, I have them do hamstring stretch and revolve triangle. So they just know when we're going to laterals on that left side, you're going to use your chair, your blocks, usually the chair, do hamstring stretch and revolve triangle. Does that make sense? Yeah? So they get that internal rotation. Because why is that good? Why is internal rotation good? Stretches a piriformis, yeah? So for sure we want to do that. So you can see the article here that talks about, I gave you a little article on what piriformis syndrome is. And you know, one way that if a person isn't sure and you want to just kind of figure it out, and you have a minute afterwards, you can ask them a very simple test, which is generally, if it's piriformis syndrome, and they go to take the leg across the body like this, it will cause pain, like ow. And if it's SI joint or sciatica lumbar involved, and you don't do it, you don't have them do it, you lift their heel up like this, it will cause pain. In particular, if you go like that. If you take their foot and you go like that, it will cause pain. So those are the two main tests they do to see if a person has, which one it is. And that's not horrible to do.
So like if someone in your class wanted to know.
You could say, well, let's just try this out. Let's just see very gently how does it feel when you do that. But do not say, okay, lay on your back, lift your leg up.
No.
Right? You lift their heel up for them. Say, how does that feel? Oh, that's kind of painful. Then you say, so you might want to check with your physician, right? If they go to cross the leg and they go, oh, I feel it here. You say, well, I would still check this with your PT, but I have this idea that it might be okay. It might be just a muscle, but let's get it checked out just for sure. And because even then, you want to say, because what if they go, oh, well, it's just a muscle, okay, I won't go. I'd say, but don't take my word for it, because I don't want to steer you wrong. If it's a bigger problem, you certainly want to know. But it just kind of gives you an idea.
So if the knee twists over the body, that slight little twist like that piriformis the muscle.
Right, because figure this muscle is really tight, right? And it wants to pull the leg this way. So if it's tight and it's pressing on the nerve, and then you take the leg this way, the way that it doesn't want to go, it's going to press on the nerve more and it's going to hurt, right? Which is why if somebody's walked in with active flare-up of piriformis syndrome, even though this is a great stretch for piriformis, you don't start here because it's going to heat it up. It's going to exaggerate it. A great place to start for piriformis syndrome is revolved triangle. It's a really great one. It's the beginning of stretching that. It's very safe. Now, the only problem is if you have them do that and it's a lumbar spine issue and they overcrank it, you could make it worse because now you're overcranking the lumbar spine, right? So if you don't know, the person says, oh, I've been having terrible pain down my leg, then I still have them do revolve triangle, I do. But I just have them do it very, very gently. So they're not getting a lot of cranking, and they get more turn of the heel, and they're on a chair. But if they're very tall and they're on the chair, or they're very flexible, and they start to be lordotic, then you got to get that out and just make it the turn. Yeah.
My favorite stretch when I'm in pain is pigeon on the wall.
Mm-hmm.
Regular pigeon can be really hard on my other knee
Mm-hmm.
and on the hip flexor.
Mm-hmm.
And I found that, I think we did it in Darcy's class, it might have been Mike's class.
Where you put your foot on the wall and then
Yeah.
cross, yeah.
And
Does that a lot?
it was
It's-
Andy's class.
It's
Okay.
great for piriformis syndrome.
That's, yeah.
If it's a disc herniation, you can pop a disc. Because now the person's like this. In fact, I know somebody who went to physical therapy and they had them pull in too hard and she popped a disc. And then I ended up with it, right? Like, I'm supposed to fix it now. Yeah. So again, I would say if you don't know, don't go to that.
Okay.
Go to revolve triangle, freedom before leverage, right? You're not pulling something in and pushing. So so you want to be really kind and careful with that. Sacroiliac joint dysfunction is really tricky because often I had this for years and years and years. I still have a little bit. It's a laxity often of the sacral ligaments. There's a lot of ligamentous tissue here. And if you've been very hypermobile in your SI joints, it can cause the pelvis, it kind of like does like this. It is often right anterior, left posterior. It kind of goes like that. So the pelvis does kind of a figure eight thing, you know? And now these teeth that should sit nicely to here, I'll do it on this one because I won't hurt Mr. Boney. These teeth that should sit nicely in here hop over one, and it's really, really painful because there's a lot of nerves in there, and you got the bones sitting ajar where they shouldn't be. So there are lots of ways to like pop it in. Some of them are like this where you create force and you push in. But before we start creating force and asking people to do that, I would really rather they go to their chiropractor or PT or somebody and do that. Now if they come in and they say, I have SI laxity, or they say I have pain that's here, what do you not want to do? Besides external rotation. We know we don't want to externally rotate. What else don't we want to do?
Let them on the stretch.
How would that look?
I'm not sure.
Okay.
No forward bending?
Cantilevering,
Yeah.
right? So you're not going to load the spine. You're not going to do Vini Yoga if somebody has it. Everything's going to be supported. Yeah? And Alice, I would suggest, particularly with older folks, and they're having pain here, we know that pigeon on the chair can be good. However, if they're brand new and they're barely stretched out, the hamstring's barely stretched out, they may not have very much flexion at the hip because the hamstrings don't give, and you could actually exacerbate it. And even just crossing the leg that way could exacerbate it. So if they're brand new and they're having hip pain and soreness, heat here, I would go to the revolve triangle. And I would leave out the pigeon till you kind of have a sense of them. Because then, like Betty Lee, you know, she works in her husband Schumann's office, and she gives people seated pigeon all the time. And she says, oh, it works great. If, you know, people go, oh, I have this pain here, I give them that, and it's good. But I feel quite certain Schumann has done those diagnostic tests and knows that it's piriformis syndrome. And again, it kind of goes to the person and what their flexibility is. Because say you have that person and they cross this leg over, now they're sitting on a chair, but they're anteverted, right, like this, and we have a vertebral issue at the base, that's not going to be a very good thing, right? So my suggestion is that you work in the revolve triangle very carefully without cranking first, just the pull of the hip back, get to know them, that doesn't cause pain, then maybe you go into a little seated pigeon, yeah, but it all goes to this lumbar. Can it stay neutral? I also think that some people, like who are, people who are flexible, who don't have knee issues, pigeon can be a great one. Pigeon can be a great one because now they're not going to go, and they're not using so much, their back can be straighter than pulling it in. If it hurts your knee, not so good. If that one works because the person is flexible enough, the big thing is I don't think you want to get too much of that, You want to keep the spine flat, and that requires, I think, Karen, the reason it's good for you is you kind of have relatively flexible hamstrings. But if I don't have flexible hamstrings and I can't pull this like this, I'm going to be like this, and then I'm going to.
That's why when he has to do it on the wall with your foot
Right.
on the wall, it kind of stops you from crunching your back or doing
Right.
anything with your
Right,
back.
right. And you can just push here. Now, if you're pushing, don't push on the knee. Why don't you push on the knee? No.
Hey, it hurts your hip.
It pushes the bone up in the hip, right? Because it's forced this way, the bone comes up. You want the bone to go down in the hip. So you're better if you've got this foot on the wall to be pushing low on the bone than up here. Does that make sense?
Yes.
Yeah? Okay. So, that's it. Let's do the sheet. So it got, have you had any diagnosis from a doctor, physical therapist, or chiropractor, medical professional? No, my back is just tight from sitting a lot at work. So then you say, any sharp shooting pain, pain radiating in your arms or legs, numbness, any particular area worse than others? And the big question is, how does your back feel right now? You're here. Are you having any back pain right now? No, it's just been tight. It's been kind of sore after. This is good news. This is like your best possible back pain scenario. It's probably just muscular pain, comes and goes. It's situational. Great. So the prescription then is regular yoga. So the cautions that you have are to keep them up on props that fit their size and level of flexibility so they can keep a neutral spine. If somebody has back pain, regardless of what it is, don't leave out the mini yoga until, the first time. Doesn't mean they can't do it ever, but if their muscles are tight, we don't want them to have to hold the weight of the head and shoulders. Go over posture and chest of drawers. Do an overall back safe class. In other words, if you see them on triangle pose doing, something like that, because this could be like a yoga 2-person would walk in and say, oh, I just have a little tightness in my back, but this is a time I could get here. For sure, we're going to recommend they come to Yoga 1, but they're probably going to be okay. And then once they've been to class more than once, begin the idea of belly strengthening, breathing, and core work, because you just can't start that the first day. It's just too many things to think about. Okay, so now you've asked me that question. I say, no, don't. I haven't had any diagnostics, but I'm having some pain in my lower back right now. They're pointing to the lumbar spine. They're not saying hip, they're not saying low, they're saying lumbar spine. So then you ask them, do you have any pain coming into your buttock or into your hip? Is there any pain going down your leg? No. So if they don't have that, then they're probably not hitting the sciatic nerve. This is good, right? Recommend that they see a physician or PT. Always, always, always recommend you see a medical professional. Whether you believe that's going to be useful or not, you want to recommend it. And why not, right? And then you should let them know that because they have back pain, you're going to be around them a little bit. You're going to be asking them how they're doing. You might have to call out their name. Say, I'm just going to keep an eye on you, so know that I'm doing it because I want you to be safe. But don't overdo it, because then they're going to feel like they're the centered out person, right? Be careful, only check if necessary. Show up in level 2 or above. Oh, and if they show up in level 2 or above and they're having pretty significant back pain, say it very loudly. This class could hurt you. This could hurt your back. Are you sure that this is a class you want to be in? Would you consider coming to a Yoga 1? Because here in Yoga 2, we assume that you have Yoga 1 skills. I'm not going to reteach those skills. And then if they say, well, I'd just like to stay and try it, then knock the class down anyway. Don't still make it about them, because we don't want to hurt them. And then afterwards, they go, oh, that wasn't so bad. And then you say, well, actually, I made it a Yoga 1 class because I wanted you to be safe, but I don't want to have to do that all the time. So you need to know that next time you come, you know, it could be yours, a different teacher, it could be a Yoga 2 class. So if you felt like that was pretty good, then come to Yoga 1, because those were kind of Yoga 1 skills stuff. So we'll talk about scoliosis, because Anthony has scoliosis, you have scoliosis, so we'll talk about it a little bit, and then we'll send you, there's a little book by, I like that book, do you like that book? There's a little book by Elise Miller. Because she has a pretty profound scoliosis, and she's the one that I studied with when it came to scoliosis. So she has a little book that's probably pretty good for that. But let's talk about scoliosis in a sec. Yes. So if somebody says they have scoliosis, then you say, the general thing is to say, well, there are specific things you can do to help your scoliosis, but it's really important just to get an overall yoga practice first to kind of understand it, and then you do these back safe things, the hinging things and all of that stuff, right? Unless it's a super profound scoliosis, but we'll talk about that in a sec. Okay, I have a protruding, bulging, herniated disc in the lumbar area, and it's current. Has your doctor said it's okay to be here? Well, I don't know. Okay, so you could hurt yourself because it's a group class, and I can't always keep my eye on you. In general, if you follow my directions and you stay up high on your props, and you don't push, you're probably going to be okay. Do you want to do this right now? Have you gone to PT? You know, just to kind of cover our rear ends a little bit. You know, often they'll say, "Yeah, I went to PT, and now the PT released me, so now I'm here." That's the more likely scenario, right? And so then I put the back safer class with disc involvement, right? If somebody with a current herniated disc shows up at level 2 or 3, then I would say, you know, this is really going to be a class that could really hurt you. I don't think that this is a class you should take today. You know, if they have a problem, they can call me.
So do you not let them take the class? I mean, what if they push back and they say, oh, but you know, I'm here and I really want to do this?
I can't say I've ever had that situation, to be honest.
Okay.
So I just
They
don't think it's
just
going to happen.
accepted it and left.
Usually when people have herniated discs, it hurts so much that they don't want to re-hurt it. I have said to somebody it'd be better to come to Yoga 1, and they've said okay. But I've never had anybody say, no, I have to stay and do this, because that's pretty painful. So they don't want to go back there. I'm having pain in my buttocks and down my leg. Ask them if they have diagnosis. Have they heard the word piriformis? Do they have any lumbar environment? Do they have any SI joint issues? I said use those words because they may have heard those words before. Okay, so they say, I've been told I have a piriformis problem. Leave out lateral poses altogether the first time. Teach them to do hamstring stretch, revolved triangle, or revolved high lunge. Remember, which one is more vigorous? Revolved high lunge or revolved triangle? Revolved high lunge, right? Because there's more muscular effort to support yourself, right? So always revolved triangle before revolved high lunge. Begin with overall back lengthening, hamstring stretch and revolved triangle. Chakravarkasana gently. Say they have some muscular tightness. Just my back's so tight right here. Besides wink your pony, this is always good, right? And if they're having SI pain or sciatic pain, child's pose very good. And particularly if, say, it's on the left side, if they take the left knee back like 2 inches or an inch, not 6 inches, that can make it worse. Just 2 inches, it kind of stretches these little sacral ligaments in a good way, and it always feels good, almost always. Chakravarkasana is okay, they just come to tabletop because that's not going to hurt them. Just a nice, I'm not humping, I'm not arching, I'm just doing kind of a back and forth glide. That's always good. What else? Gomukhasana is very, very good for piriformis syndrome, but not right away. Double pigeon can hurt piriformis syndrome. It's a lot of cranking, so I would not put that in as a piriformis thing. Foam rolling, very gently on the buttock area, but if they roll with balls in the buttock area and it's inflamed now and they roll right over that muscle, it can make it worse. So if they're rolling with balls on the hips, I'll say go around the periphery of the buttock, but don't go in the center, so they're not right on it. And same thing with the foam roller, you know. They're not gonna press really hard, they're just gonna go kind of easy on that. And if they do roll out the hip a bit with a foam roller, they should roll their IT band too, because often they're related, right? They should roll everything. While you're there, roll everything. Well, be a little careful with the quad and hip flexors so they're not arching their back. So I put the back safer class here. We'll get to those in a sec. Okay, I'm not sure. I have pain in my buttock. It's going down my leg. I don't know what's causing it. Then you treat it as though they said, I have disc issue causing the sciatic pain. Because you don't know, so, you know, make sure you're safe. So again, if they show up at yoga 2, if they stay, tell them not to do lateral poses or spinal hyperextension. Be careful in rotation. I would, you know, I don't think you're really going to have that. Work on things that create length in the back. Do a lot of shoulders. Here, this is the other thing. If people have back pain, you don't really know what to do. Don't do a whole lot of stuff at the back. Do the things that create length, and then work on shoulders. Work on breathing. Then you're giving them something that starts to relax their whole body, but you're not completely addressing it, saying it'd be really good to know what's going on with this. I would really get a diagnosis. And then if they say, you know, and then you just let them know if they still have this pain and they're going to yoga 2 or above, it's not good. If they're in yoga 1 or ultra gentle, do the back safer with potential disc involvement class. So I made those classes. All right. So ultra gentle back safer class. Isn't this nice, Allison? I did this for you. This is for when someone new who has back pain who can't get down on the floor arrives. And it's good for you to know this too, because if you teach yoga 1 at all, you kind of want to know this. So it's good to start seated on the chair with blocks or something, just to get the breathing going, but don't sit too long. Encourage them not to overbreathe and not to lift the chest up, because as soon as they do that, they throw weight into their lower back. Standing up, teach the chest of drawers concept briefly, and encourage them not to bring the hips forward when arms are overhead. So you go, teach them not to do the Starbucks slide. Then I would go to Movie Groovy, right? Because Movie Groovy is going to bring warmth into the body. I would not do arm circles, because this is somebody brand new, right? We're loading the back. I wouldn't do spinal rotation, because we don't know what's going on with their back. I would leave out arm scoopasana. I would just do it with the shoulder. I wouldn't scoop the back. And I would leave out standing cat stretch, because again, we don't know what's going on with their back. But you could do hip circles, you know, just gently to the way you feel it. A palm tree, only one arm up at a time, reaching up and reaching down, not necessarily because you don't want to get too much momentum. So if you have any pain bending to the side, don't go that far, right? If you have somebody with back pain, don't demonstrate it too far, so they don't go, oh, I have to go over like Alice is. Then I like to, from there, teach the hip hinge concept with spider. Because now you're gonna, before you do the calves, before you do anything, because you have that seat of the chair right there, and now you can get them pretty wide, and you can get them here, and get their hands down on the chair, right? And then you can teach them to put their hands back on their thighs and come up, right? As opposed to trying to teach them here or trying to teach them here on the chair. This is a nice stable way for them to learn, and you can really talk about the tailbone being one end of the teeter-totter, this being the crossbar, the fulcrum of the teeter-totter, and the rest of your body stays straight like a teeter-totter or like a dipping bird. And I would go right there then. And then you can have them do a little bit. Now here you are, you've been standing up, then I would do again. I would just keep putting that in, because people who are older and who have back pain probably haven't been moving much because they are in pain. So if you keep putting this in, you keep moving energy through the body, keep keeping the blood flow. Then go to hip hinge for calf stretch. And so now maybe you use the chair, right? And if it's first thing, then this is ultra gentle. You don't necessarily go into this one, because now you've got this, right? So you have them either hold the chair here or hold the chair here, bend your knees, hinge at your hips, foot back. Now come up on the toe, Now I have neutral spine, right? If I don't know what's going on with somebody's back, I'm not going to have them do this right away, the first class, because I just want to see, what we want to find out is, if we know we did everything as safe as we can, we didn't do anything that should mess things up, and they say, oh, I had horrible back pain after that, then that's really good information, right? But if you do this, it could be what you did that did it. And we might do it wrong, could be that. But it's just good to take them really progressively. And it doesn't hurt anybody. Like you say, oh, well, all those other people know how to do it the other way. That's fine. You know, we're all going to get our calves stretched. We're all going to work at maintaining a neutral spine. So you make it a lesson for the other people. You don't have to say, oh, I know you all know this, so it'll be a nice review. Say, let's really think about that chest of drawers. Are we all keeping our chest of drawers? You know, so it doesn't look like they're just accommodating somebody who's injured. Do you know? Okay, so then we went to calf stretch, then the hamstring stretch, either on the chair or these are really good to know, because you could use this in a Yoga 1. You could, I don't know if you'd use it in a Yoga 2, but still. Then I would go back to spider. Once you stretch hamstrings both ways, I would go back to spider. And then I would do wink your pony without winking first, just stretching the back. You could put some arm stuff in there. I should have put some arm stuff in there too, just because, you know, in between sides kind of stuff. Now, if there's piriformis involvement, try the revolve triangle, nice and safe. Don't do it right after the hamstring stretch. Get them up, move them around again, and then go back to it, right? Because it's too long to stay there. And I wouldn't do, as I said, I wouldn't do seated pigeon in the first class. I would wait and kind of see how they feel. If it's okay, and if that's been okay, then you could do seated pigeon also. But I wouldn't do it right after. I'd move around a little bit. And foot and hip circles, all of this stuff, very good, right? Wink your pony after that, gently side to side. Clock face without too much rotation. And without too much, you can always do clock face. If you got a person with a back issue and you think that this rotation isn't going to be good for them, or this flexion isn't going to be good for them, you can do clock face like this, right? And you can do, you know, like this. So it's sort of the same thing. You're just standing in cruise ship stance. So you leave out any torquing of the torso, which doesn't mean that they can't ever do that rotation. But in the first class, let's see. Let's leave that out. Arm pull across with any kind of chest stuff. Seated neck stretches. Child's pose on the chair with 2 chairs. You know how to do that one? Yeah, I like that a lot. Alternate, and especially if somebody comes in with back pain, a great way to finish any class is in alternate nostril breathing. Because they've gone through something, they've had some emotions, some fears, they're worried that their back is going to hurt. Finish it out with alternate nostril breathing and just cool them down at the end, you know, balance it out. I think that's kind of a good way to do it. And maybe some belly breathing. All right, Yoga 1 back safer class. This is for somebody who can get down on the floor. So I'd still probably have them come into their body by sitting on their chair or their block safely. I wouldn't have them sit there for too long, because if they have stenosis, then maybe that's not going to feel good on their back for very long. And then I would go to, and so Anthony, this is kind of like for you, then I would go to wrist figure 8s and hand pull down, so you warm up the wrists a little bit, so that then you can come to all 4s. And I like, if somebody says they have back pain, I like to just have them do this, not big circles right away, but just say, how does that feel? If I have a private lesson and somebody tells me they have back pain, I'll say, how does it feel to do that? Oh, as soon as I go back, it hurts. Oh, okay, so now I know something, right? This is too much, right? So then maybe I'm going to come carefully, and I'm going to come and lay on my back. And I'm going to pull in one knee at a time and see how that is. But we don't have to make this big. But if they go, oh, this feels good, you say, then you can let them just expand their range of motion, see how that feels, right? If they have a big posterior bulge, then they do this just within a neutral spine. Then on the back, then you do the knee in. So Miranda, this is for you too, right? So you do the in for 2, out for 2 slow, but teach them not to yank or pull, because then you'll get the back done. then you can do, if they're gonna take both knees, watch that they don't do this, right? Because that's force on the back. One knee, now you've got this stable, then you can pick up the other knee. And just tiny circles, how does that feel? That feels okay? Can you make them a little bigger? Does that feel okay? Generally, that's okay. It's this that's the problem. Okay. Oh, and then I think that next one is legs up and wide, right? Just very gentle, not, if they're like this isn't good, but just like this is good, circle feet because it flattens the back and it gives them kind of time to breathe. Sometimes if a person says that if they're relatively athletic and they're not having a lot of current back pain, sometimes I'll do windshield wiper and I'll stand right there and I'll say, how does that feel? Oh, that feels kind of good. Okay. I could go here. Oh, right? Okay, so just there. Just like that. You know, and sometimes it feels really good for them to go a little further. So say you're doing that with your class and the person, you just stand right next to them. And everybody else knows how to windshield wiper, so you just say, here, how about you just go like 20 degrees? Yeah. And if the person is really in quite a bit of pain, then I wouldn't do that at all. I'd say, you could give everybody else the windshield wiper and just say, how about you circle your knees for a little bit, or you keep your legs up for a little bit. And then the one leg pull across with 90 degrees. And if they go, ow, that hurts, then you know they've got the piriformis issue, so that's good information. And then I come back up and I go to Chakravakasana, but not with massive flexion, massive extension, just kind of, I call it all fours rocking. Because often that feels really, really good. Child's pose with wide rib breathing. Maybe child's pose if just one side's sore to the side. Stand up with hinge hips and teach the using blocks or chair, hands on thighs to get up. Right? So if the person has a really sore back, they use a chair to help them get up. And you might say, do you have a way that you like to get off the floor that keeps you safe? Because maybe they do already. Then if you see them kind of do something really, you might say, and here's another way. And if they're if they have back pain and they're using the blocks, they don't take the arms to the side. They use the hands all the way, right? Okay. Where am I now? Oh, and now we're standing up and we talk about a chest of drawers. And maybe we just take the arms up to the side and down. We're not going to load them too much. And we just talk about when the arms come up, the hips don't come forward, and that the arms can come slightly forward to the body. Because sometimes it's because they're trying to do this that they arch their back. So maybe you do 4 breaths like that just to get the feeling of the hips not coming forward. And then I would go to movie groovy. Because nothing, movie groovy is like the best thing ever. I would leave out arm circles, spinal rotation, arms up and over, and cat stretch, unless it's minor. I mean, if they just have minor sore pain, then you can do the rotation. But if they say I'm really having back pain, I would leave the rotation out. Gentle hip circles, palm tree. Then it kind of goes to what I do with Alice. Oh, I put teach hip hinge concept and do calf stretch with toe raise. So then it would just be like this. You could do, if you could go to the spider on the chair like Alice had, like the Ultra Gentle has, but you could also do, so we hinge at the hips, we step the heel back, we could use the shoulders here, we come up and we come down, but we stay in this long spine, right? So we're not giving them this yet. We don't know how that's going to affect their back, especially if they have a gut and it's pulling on this, right? So that's another possibility. Or you could, you could talk about this and no, don't do toe raises. People with back pain, not a good idea because there's too much instability. I would leave that out. I would just do the straight calf stretch. And you kind of have to do calf stretch with brand new people because every time you go to do anything else, our calves are so tight. So you kind of have to do it. You could have them use a chair, too, on the front or on the side. Then I would go to spider. And then while you're there, you could do a little bit warrior 2 and a little bit of hip shift. If they have really bad back pain, don't do that. If they have sciatic involvement, don't do that. Go to your hamstring stretch with a chair. Do wink your pony without winking, just a back stretch. Then repeat the hand, maybe you do some arms, you put, after number 20, put in, do some arm stuff. Arm stuff to 20A. Something to move the shoulders, you know, arm across like you do, Anthony, I like that. And just as you're doing those arm things, always tell them don't let your hips slide forward. Then do your hamstring stretch to revolve triangle. I wouldn't do seated position with them until you kind of know them a little better, kind of get an idea on their hamstrings. Sit on the chair, do your foot and hip circles, don't do crescent pose, wink your pony gently side to side. Clock face, either with a little bit of rotation or facing forward. Then you do some arms and stuff, do some neck stuff. You could do child's pose on the floor, or you could do it on the chair with 2 chairs. And then repeat your back lying sequence again before you finish. Repeat your knee in, repeat your circle, repeat your feet up and wide, and legs up on the chair, and I would do alternate nostril breathing. Does that make sense?
Wait, child's pose on the chair with 2 chairs?
Yeah, so you sit on one chair, and you put the seat of the chair out in front of you, and you just slide away. Like, I like to go down to the floor, but if you have back issues and you don't know what's going on, you put them on the chair so they get lots of length, but they don't. And not that there aren't other things you could do, but this is kind of a good beginner thing to do so that you kind of get to know them and you feel like you have something going on. I'm trying to see what changed for back safer with credential disc involvement. I think I didn't go down to the floor.
Yeah. Just if they can go on 17, but if they can go down.
Yeah. Maybe.
So you
But I probably wouldn't,
put them on the floor.
I'd probably get them moving a little bit first and see, and if it looks like the person is having a discomfort standing up, then I might hit the deck and go to the floor.
Yeah, because like, what if you don't really want to sit them in a chair for too long
Right, so you kind of want to take them up and down a lot.
either?
We can look at that one and see what you think.
So the fact that these involve chairs, would that mean that we're generally talking about either ultra gentle or level 1?
Yes. However, you have somebody that comes to yoga too and they have back pain, there's no reason they can't be up on a chair for revolve triangle or for triangle, revolve triangle, all those things.
So
You know,
you
hamstring
have
stretch.
to suggest to them to please use a chair?
If they say they have back pain,
Yes.
say, you know, it probably would be a better idea, or cylinders, depending on their height, right? But you can, the reason the chair is good is it's more stable, right? And say somebody does come to yoga too and they have back pain, I get everybody to do wink your pony. Let's all have a chair. Because, you know, it's amazing to me when Yoga 3 students don't know how to wink their pony. Everybody should keep getting reminders of how to wink your pony because you should be, I mean, I do it 5 times a day. So I think everybody should do it 5 times a day. That's what I think.
But with this, we're just doing pullbacks instead of.
You do pullbacks first, and
Oh,
then you kind of see how is it, you know? Because if they're just like this, that's all they can get. You could even then, once they're warm, you could kind of just turn it a little bit to get a little QL stretch. But
So would you tell everybody else to do wink your pony, and then with them you would
sure.
say how do you
yeah,
feel?
just a little bit. Yeah,
Oh,
let's
okay.
just do this small.
Okay.
But if they have a massive posterior bulge to the left, I'm not going to have them wink their pony to the left, right? But yeah, I think that's good. All right, so that gives you lots of choices for your back pain people. Yes? All right. Wish somebody had written that down for me.
So it would be a good idea to bring something bring this with us if we are having a level 1 class. Because if somebody walks in, or you walk in, and you don't know the class, and you find
Right.
out there's a few people with back pain, you chuck what you thought you were going to do, you pull this out, and you use it.
Just have it right there. I think that's a great idea. I think that's a super idea. I really do. Yeah, why
I'd be
not?
scared to death otherwise to try to do a class.
Right. Like that could happen, Suzanne, on a 4:30 Saturday, right? Where it's supposed to be yoga too, but somebody walks in, this is the only time they could get there. And so you go, oh, well, today we'll be stretching our backs. Your back is not only curved, but usually there's a rotational aspect to the curve of the back, right? And there's lots of questions, which came first, the rotation or the curve, but Lauren Fishman thinks it's the curve. Curve came before the rotation. As the spine starts to curve, the body starts to rotate, yeah? So Anthony had some surgery for scoliosis, yeah? So what did you have done?
L4, no, T11, 12, and L1 and 2.
And you had
Yes.
those fused, okay? And how long ago was that?
2007.
And did you have a left lumbar, right thoracic?
Yeah.
Yeah, okay. Can you see it in your back now? So, look and see, let's see it in your back. Oh, yeah. So this is how it's a good way to see scoliosis, right? Yeah, you don't very much going on there now. There's a little bit of thing here, look how nice that looks. Pretty good, huh? We'll look on Miranda's back. and we'll see.
When I first did this, and I found out, one of these sides, for which one it was, but there was a definite elevation difference here.
Right. I might have the book here. I might have at least, I don't think I do. Yeah, his back looks good. If it's a functional scoliosis, like I have a functional scoliosis. So if I go like that, you don't see the scoliosis in my back. If I stand up, you can see the scoliosis in my back.